Hey there, guys. Dr. Cam from Ground to Overhead PT coming back to you for your daily body armor. Today, we're going to talk a little bit about the hip and specifically hip internal rotation. Um, this can maybe precipitate or show up, right, in many different forms. Hip pain, that is, or maybe there's some weakness at the hip with the internal rotators, and you're starting to feel it maybe when you're running, maybe when you're squatting, doing other activities, box jumps, things like that. You may even have knee pain, right? The internal rotators might be weak at the hip, which ultimately causes pain down the chain. So I wanted to address this with a really simple exercise, but very effective exercise at targeting these hip internal rotators. And really all we need is a little round band here. Now, you may use TheraBand that you've received from another therapist. You'll just have to tie that thing into a loop. But either way, you want an elastic band. I would recommend something somewhat light to begin with. And as you get a little bit stronger, you start to progress that with some thicker bands. And then again, just build that capacity back up at the hip. So we've got the band here. The other thing that I like to use is a weight, just to sit up a little bit higher onto the surface here. And what we'll do, we'll get this around the bottom here, and I'll show you kind of how to set that up. But yeah, let's go ahead and get into this. So again, I'm going to loop this around this bench here. That way it's nice and secured. Okay. Actually back this bench up a little bit so everyone can see. All right, from here, I'm gonna go ahead and grab a weight. I'm gonna sit on top of this weight here. The next thing we're gonna do is we're gonna loop our foot, the affected side, into this band. Okay. Now, as you can see, the band already wants to pull me into hip external rotation. All right. So therein lies our exercise. We are going to resist that and push out, and then nice and control back in, out, and back in. Try to avoid, any kind of herky-jerky motions here at the body. We're trying to maintain a nice level pelvis here, and just allow that hip and that femur, this bone here, to rotate inside the hip. All right. I would say 2 to 3 seconds out, 2 to 3 seconds in would be a really good dosage there in terms of tempo. And then again, 10, 12, even up to 15 repetitions, depending on the strength of the band there. Love, love, love this exercise for isolating the hip internal rotators. If you guys have questions about this, or maybe you've had some hip or knee pain and can't quite figure it out, come check us out here at Ground to Overhead PT. Subscribe and like our page, and I'll see you next time for your daily body armor.